The Health Inequality Framework is a framework that you can run alongside the engagement work you're doing to ensure that you're being equitable in the way you're going about it and make sure that all the voices that need to be heard are being heard.
It's going to mean that we really focus on hearing those voices that are sometimes unheard. So we do a lot of work to work with marginalised communities and often called underserved communities. We want to make sure that we serve them to help them to reduce inequalities in their areas. It's really lovely when an organisation says that it wants to co-design something and then it actually does. So there were people with lived experience involved. They involved system leaders. They involved people like myself who do community engagement as their job. And we came together, we worked really closely together. I was delighted when we got a chance to test it and pilot it in Gloucestershire.
I think if you're engaging and involving communities, it's really important to use the framework, especially to address those health inequalities. You know, we could also get the buy-in with our community and voluntary sector organisations. We have something called an alliance where it brings together over 8 different charities and communities, and I think if we can give them the tools as well, it can then feed into the work that we do as commissioners.
When we applied the framework, we saw a lot of things that we were doing reflecting the framework, the stuff we do naturally, but then there was some other bits where we could kind of improve on that work. And that's coming from a really experienced team in a big organisation. So if it can help us, it's definitely going to be able to help other partners as well.
We had a think about recent engagement work that we'd done. So one was around speech language communication needs for young people, and the other one was around the development of a website called Not Alone. We did some previous engagement work in relation to that, and we used the framework to look at the work that we've done and how that can be then done around the you said we did and the so what, and the evidence and the impact that it can have on those specific communities.
I think using the framework can really help build trust with partners. So it's about sharing the power and saying one party doesn't have all the answers. So for example, the ICS, we're saying, look, we need to work together to get this right, which is so important, and we need to reflect and be open about what's worked, what hasn't worked, so we can learn.
I think it's more important not just for us as engagement, co-production, personalised care team members. I think it's more important around how commissioners can use that framework to evidence the engagement work, but also how we address those health inequalities for those underserved communities.
I got involved through National Voices as a lived experience partner alongside my colleague Marcia. We both bring real experience around the experiencing of health inequalities, and we're really excited to get involved in developing a framework.
People who experience health inequalities are often left out of conversations around health inequalities and improvements that can be made. And people with lived experience are experts in their own lives, their health conditions, and the lives of their communities as well.
So the framework will really help integrated care systems to really focus on listening to people that they don't always hear from, and it allows real collaboration and partnership working with people and communities.
I mean, addressing health inequalities is essential, and I think what we know is that people's health needs are impacted by wider determinants of health.
People with a learning disability still die on average 20 years younger than non-disabled people, and many of those reasons are completely avoidable. They're due to health inequalities.
Building awareness around not only what health inequalities are, but the ways that we can work to decrease them, especially through engagement, through listening to people when they might not necessarily be historically as open to engagement or active in engagement. I think taking steps through the framework to engage with them is naturally going to help.
So I think the framework will probably be driven by ICS leads, but everyone should be getting involved. So providers, the BCS, individuals from communities, we should all be working together to make sure the framework is representing our experiences and those of the people who we exist to serve.